With overseas medical or aesthetic work, there's a few issues. Number one, it's very difficult for patients to find the right person. Number two, there can be a communication breakdown. Number three, sometimes infections happen.
More Singaporeans are going for surgery and treating our bodies and faces like these projects that we need to work on, right?
I think you've heard of the term office-based procedure, right?
More Singaporeans under 30 are going for plastic surgery, and the number of botched jobs are also on the rise.
Dr Janna Joethy is a Singapore plastic surgeon who works at the intersection of aesthetics and reconstruction.
From everyday cosmetic procedures to complex microsurgery and burn reconstruction, he sees both sides of what it means to change a face or rebuild one.
What kind of surgeries do you see more of now? Like in terms of plastic surgery, is it eyelid? Is it
work on the bum? That's becoming more and more common.
and
I think Brazilian butt lift, you've heard about that, right? So that's also spread, I think, from different parts of the world. And the other thing that's happening is the whole gym culture. So women are posing with very fashionable leggings, and they're always doing leg workouts, sports.
Yeah. Athleisure, right?
Athleisure, yes. And they're going to the gym and they're trying to say that, they have a certain look to their bum, and people going to the gym trying to replicate that, not getting it, and they think, how do I now make this better? So that's where the Brazilian butt lift comes in.
Right.
And obviously we modify it for our local patients who say, I want this look. I don't want a huge bum. I want a bum that's slightly bigger. Because
Asian context.
Right,
the
yes.
Asian context.
Yes.
And when do you feel then it crosses the line? For example, a common procedure most people think of, to try and test waters with maybe cosmetic surgery is botox, right?
Yes. So that's why that whole concept of is plastic surgery addictive? That's where that concept comes in, because people who do the injectables, botox and fillers, typically they will like the look, right? You get patients who've never done it before. I get patients who've never done it before. They do it once and I really like the look. And this is the ongoing process with my patients. So my process is a little bit different when I do my fillers. So I will inject a little bit and the patient will say, I like the look. There's always that thought that I look nice after, small amount. Maybe I'll look better if I do it more, right? And that's usually a misconception, right? And I'll tell them that I don't think that necessarily works, right? Because like you say, there is the point where enough and versus overdone, right? And that sometimes can be quite unpleasant looking if you put too much into it. So I do get that sort of clientele, unfortunately, who have gone and had aesthetic work done different parts of the world, and they feel that there's too much. I'm not sure why they had so much to start with, right? And it's obviously settled down. They've had a procedure, they've come back, they're too much fillers, too much this, and they feel, now I don't like the look. It looks overdone.
And they want to go back to being natural.
Yeah.
Right.
So up to a point, you can reverse it. And it depends which type of fillers that are used. So that's something that we'll discuss with my patients and say, we might be able to make it better if we know certain fillers you can make better quite quickly.
Why do you then think more Singaporeans are, doing the surgeries now? Adding on to that.
So social media has made people more aware that these are the options I have. If, for example, I want, a bigger nose, or I want my double eyelids done. So if you see it on social media, now you're aware that this exists. If you've been thinking about it, if you think, I wish I had a bigger nose, I wish I had a certain look of my eyelid, the algorithm will feed into what you're looking for.
That's right. Yeah.
So you keep looking at the same thing and you think, maybe I should try it. And then you speak to a friend who's done it or looks different. And you say, what did you do? I saw so-and-so and this is what I did. And the person will explain, it was very easy. I went in half an hour, I had this, I had that done. So people are more open to that now than maybe they were 30 years ago. And I think younger people are also talking about it more. Whereas maybe a generation ago, the older people generally don't want to talk about it.
There was a stigma to it.
There was a slight stigma or slight, I don't want my friends to know I've had it done. Right. Now it seems to be almost open. People are more open about it or willing to talk about it, right?
Like the Kardashians are quite open.
Correct. So they've gone on social media and, because they're celebrities, people are aware that so-and-so had this done, so maybe I should also do this.
Recently, we had this report, right, last year, that a lot of younger people, more Singaporeans are going for surgery and kind of like treating our bodies and faces like these projects that we need to work on, right? So do you think that could be part of that misconception as well?
I think you've heard of the term office-based procedure. Right. So or lunchtime procedure.
Yes.
So people think, I'll go and do something at my office lunchtime and come back to work. Right? So patients go for an aesthetic procedure with either an aesthetic doctor or a plastic surgeon. They get something done and then, 2 o'clock they're back at work in their office. It's very popular. People say, I'm going to do this, I'll come back. right? Just like people go to the gym at lunchtime. So people will say, I'll go and do my filler, I'll do my botox at lunchtime. And then you also have your friends doing it, right? So now you go to office and your colleagues are saying, I'm going to go lunchtime procedure and I'm going to do this and I'm going to do that. So it becomes normalized, as it were. And the other aspect, you have pressures from social media or influencers doing it, and they're telling you this is what the clinic looks like, this is where I went, and of course this is my result.
One thing is, they do look at influencers or trending, surgeries that others have done. But another thing is we have these filters on social media, right? The Instagram filters. So everyone's like, oh, I look great with that filter on, right? So I'm sure patients do come to you and say that, can I look like that? So how do you manage their expectations? Because that is, after all, a filter. It's not a person's face. So how do you manage the expectations between reality and Instagram?
So Durga, the question is deeper than that, because if you look at the different lenses at which a photo is taken from, if you take a telescopic camera view versus the wide angle, there's a difference. So in certain views, your ears look a little bit more like this, and the face looks elongated. And this can happen, or was happening a lot during COVID, right? And things changed around COVID. Why? Because there's a lot more meetings online. And people are looking at the images on the computer as they were talking. So now it was a real time or real live feedback to yourself on what you look like or what you were appearing to your friends, right? To the 10 other colleagues who were in different parts of the world. And you suddenly looked, oh, I don't like how I look on the image that is projecting on Zoom or whatever platform you're using. And same thing with social media. The image is a distorted image, because as a very basic, crude understanding, you're taking a 3-dimensional face and making it 2-dimensional on a camera, on an image that you see in a handheld device. So patients are now trying to respond and react to that and say, I want, on the basis of a 2-dimensional picture, I want a bigger nose, or I want more prominent ears, or I want this, I want that. So the concept is changing, because it's less of a 3D thing, it's more of a 2D thing that you're responding to on the basis of all these filters, of not even a filter, of the zoom, the camera lens that's attached to your phone.
Now, Dr. Janna, have you ever, we've spoken a lot about the, parameters for a patient, right? Have you ever told a patient that I don't think you should be doing this? And have you, sort of lost that patient because of that?
100%. Recently, I had a mother and daughter coming to see me. And the daughter was studying overseas, I'm not sure where now, but she's very young. And the daughter wanted to have fillers done. And it was a birthday present for the mother, from the mother to the daughter, to get fillers done. So I explained the risks of the procedure of any filler. And I said to her, there are these risks. As I mentioned to you, I tell all my patients there's a risk of blindness, there's a risk of skin necrosis or skin loss, there's risk of swelling, etc., infection. These are things I say to all my patients. And she said, no, I'll think about it, doctor. I don't want to do it. I said, fine.
How young was she?
Well, she was less than 21.
Oh, wow.
So the mother wanted, and I was like, I'm not sure this is really going to benefit her, and I don't know if we should be doing it in her, because she didn't really require it. I think it was something that the daughter had picked up on social media.
Right. It sounds like, Dr. Janna, like plastic surgery is not the sort of like means to an end, right? Like it's basically, it's just like anything else that we want to do, right? You still have to put in the work.
Most of the time, yes. Right? There are some surgeries, of course, that you do it once and you're happy. Like example, breast augmentation, eyelid. You put an implant. Patients have come in thinking, I want bigger breast, or patients have come in thinking, I want double eyelid, or I want to remove my eye bags. That should be, a one-off surgery rather. So you do it and you're happy, right? So there are both aspects of it, right? That some surgeries require maintenance, some don't. Of course, there are patients who will say no. I can't exercise, I have to eat a certain way. Those are not ideal patients, right? So you want to pick a patient that will work with you.
Right. Now, in Singapore, we are very multicultural and we are all Asians, right? So when patients come to you, say, with a photograph of a, Western influencer or celebrity, how do you balance or enhance how they look without erasing their identity as someone who's Asian?
We're not trying to make an Asian face a Western face, right? And even more fundamental than that, the anatomy sometimes can be different. So, for example, the eyelid of a Chinese person, Oriental person, is different from a Western person. The anatomy is different, so we shouldn't be doing the same thing, same type of surgery on a Chinese patient versus a Caucasian.
And now you also see younger patients coming in, I'm sure.
Yes, very much
they're
so.
getting a bit younger and younger,
Yes.
right? So with younger patients, what is your approach to them? I mean, how do you advise them?
They will come in knowing what they want to do. I've got a crow feet here, I want to target that, or I want bigger breasts or bigger nose. And in those patients, you have a conversation. What are you aiming to achieve out of these things? And are you willing to accept the downtime? Are you willing to accept the surgical complications as you would do to someone who's older? But maybe you spend a bit more time because they're younger. But by and large, they know what they want by the time they come in. They're not coming to say, oh, what should I do? They're coming to say, I think I want to address my nose. I want to address my eyelids, right? So in the younger patient, again, with a lot of patients, it's about educating the patients, telling them this is what it involves. This is what the complications are. These are what the risk factors are. This is where your scar is going to be if you do this. Are you okay with this? And so those are the conversations you would have with patients.
Younger patients. Now, we do have a lot of reports now about botched surgeries. As a doctor, what do you feel that happens when these procedures go wrong? What are the consequences that patients must understand will happen if you don't go to the right people?
Yeah. So I think with overseas medical or aesthetic work, there's a few issues. Number one, it's very difficult for patients to find the right person. Finding someone on social media or because your friend went there and had a good result doesn't mean that person's very good or very bad. It could be that he's good, it could be that he's not so good, right? So I think it's very difficult to do the proper homework when it comes to doing research on an overseas doctor. Number two, there can be in certain countries, depending on where you go, there can be a communication breakdown because you need a translator, right? So when you're going to some countries, the doctor doesn't speak the same language. There's an interpreter there to translate for you. So I think there is always something that's lost in translation, I feel. Number three, with regards to botched job, it isn't always the fact that the surgery was done badly. I mean, there's some very good doctors within Asia. There are lots of good doctors in the world. Sometimes infections happen, right? Maybe it's because the patient was out and about too much. You go overseas, you do a surgery, then you have to take a flight back home. You have to be out in an airplane, different environments. Maybe that increases the chance of infections happening. Right.
We always see this on social media. When they do the botox, if they can't move this part, is that a real sort of like test that if you can't do the expression?
From parents who say, I want a little bit of botox, right? But I want my kids to know I'm angry. So if you're telling off your kids, you want to do this, right? If you freeze that, then you can't do it.
Right, okay. That's an interesting ask, I would say.
So then you have to be very careful in terms of how much you do, because patients are very specific now. They say, look, I want a little bit. I don't want to go completely frozen, right? So conventionally, muscles are attached to, bones to help you move, right? That's usually the lay perception. But in the face, a lot of the muscles are attached to skin.
Ah, okay.
Right? So in things like botox, if you're trying to paralyze the muscle, right? And it's a temporary paralysis, so you can't move the muscle. And if you can't move the muscle, you can't move the skin.
Right. So that's when you know.
Correct.
You've gone.
But it also depends whether you're going to use it, right? So for example, you've been quite expressive in this conversation. You've had your eyes down, you've done this. So, you're moving that, right? But if, let's say, you had botox and you can't move it, then you can't express. If you've gone for the completely no expression look. But most patients tend to want some expression. They don't want to go zero expression, right? And if you just think about it, an expressive face is what you want, right? You want during a conversation to read off someone's emotion from their expression. That's also a
non-verbal language.
Non-verbal, 100%.
Yeah. Dr. Janna, I have to ask you this, right? As a plastic surgeon, how do you define beauty in today's world, in 2026?
Yeah. Great question. So beauty is one of those things that keeps evolving over years, right? You look at pictures of movie stars in the 40s, 50s, 60s, 70s, the body shape has changed. So there have been subtle, sometimes very obvious differences through the generations. But to me, so there are certain guidelines to beauty. You've heard about the thirds of the face and the fifths of the face. You've heard about the symmetry. Right? So those are one aspect of it. But so it's a conversation between the norms of beauty, as it were, and what the patient wants, right? So if a patient wants bigger lips, bigger nose, that's his or her perception of what they want to look beautiful. And you have to marry that with the norms of what are beauty standards. Right? So if someone says, I want big lips, for example, you know the standards of, on basis of his or her face, the proportion, what it should be. But if then they say, I want bigger lips or slightly more than that, then it becomes an obviously bigger lip. But the client may want that look. And that's
the beauty standard.
That's the beauty standards for that person.
Right. And are men becoming more open to procedures?
Very much so. Very
these
much so.
days?
I think that's changed with time. Many years ago, there were very few men typically that were coming for procedures. Now it's getting more and more common. Facelifts, men are doing it as well because they want to look younger. Right? Now, one of the things we mentioned earlier, if you're 20, you want to do a certain thing, maybe dating market, 30s, maybe job market, 60, you're thinking, I'm retiring. What can I give myself as a retirement gift? I'll go for a facelift.
Instead of a sports car.
Instead of, or a sports car. A sports car. So that's, by the by, do both, right?
All right. You were mentioning that, you like doing what you do because there's an artistic element to it as well. Could you share more about that?
One of the things that I found very appealing or attractive in plastic surgery was that I felt that there was an art as well as a science to plastic surgery. And the fact that as plastic surgeons, we do aesthetic work, we do reconstructive work, we do burns-related work. So those are three different fields of plastic surgery. But there is a common underlay to all three of these things. And we operate from head to toe. For example, hair transplant, skin cancers on the face, breast augmentation, you name it, we do it anywhere in the body we're operating.
So if a patient does surgery younger, does that surgery sort of need maintenance, in that sense, as they grow older? Does it fade with time or does it stay the same as time progresses?
The aging process is not a very direct, it's more complex than people think. There's multiple layers of your face that change, from your skin all the way down to your bone. Everything you can think of has gone some sort of change, right? So at 20, those changes haven't all happened.
Right.
Whereas at 60 or 70 or 80, you see the changes. And you know this from older people and younger people you meet, right? And if you look at pictures of people in their 20s versus 80, you see that change that's happening. It's not just skin. It's skin, it's the bone, it's fat, everything in between has changed, right? From your skin complexion, you get pigmentation, the bone becomes more hollow, the bone shape changes. So all these things are happening as the person ages. So something like eye bags, if you do them today, at 20-something, they may come back in 10, 15 years' time. And that's a conversation I have with my patients. Same thing with breasts, right? They undergo change on age, and depending whether you get pregnant, breastfeed, all these changes are going to happen. But yet women still want to do implants at a younger age.
Right.
So they're aware of the changes. We tell them the changes. And they may do implants and may say, oh, can I remove them after 20 years? Yes, you can. Some don't want to. Some are happy with them for the rest of their lives.
Right. So like chronic illnesses like diabetes, blood pressure, do those factors affect it as well?
Very much so. So if you're someone who's got high blood pressure or diabetes, and cholesterol, you want to make sure that those are well controlled before you consider any surgery, right? Because for example, if your sugar is not well controlled, your healing is affected, right? Okay. If your blood pressure is not well controlled, it's a danger to go for surgery with high blood pressure, right? So you want to make sure all these risk factors are reduced before you have the surgery. Before you even think of the surgery. So if someone came to me with very high blood pressure, we would address that first before we consider any surgery. If we have the luxury of time, if it's something aesthetic. If it's reconstruction, then it's a different ballgame. There's a sense of urgency.
If this conversation gave you something to think about, don't stop here. Every episode on Open House is a chance to see the why behind success, resilience, and growth. Click on the video